The conjunctiva is a land of many woes. We particularly think of this as having a lot of red eye.
Yes, the redness comes because it's a white area. The sclera is white with vessels on it. The conjunctiva is just transparent, so you can see directly onto the sclera. Now, when the conjunctiva gets inflamed, it gets red. And for us, the most important question is what else is going on?
Right.
Is the eye just red?
I'm looking at itching, light sensitivity, vision loss. I don't normally think of a conjunctivitis causing vision loss. There I start to worry about the cornea, the center part of our vision, being affected.
And the challenge there is if you have a red eye, you need to ask certain questions to make sure that you assess the patient correctly.
One of those questions, let's start with, have you been in contact with anybody with an infection or somebody else who's had a red eye?
Because it can be contagious. Have you been sick recently? Oh, I've had a cold last week. Oh, I have a stuffy nose. That all might lead you to think this is an infectious cause for a red eye.
Any trauma? Have you been hit in the eye recently? Maybe your kiddo scratched your eye or something else happened.
Do you wear contact lenses? Contact lenses themselves can lead to inflammation of the eye, corneal ulcer, which then also shows up as a red eye.
Any contact with a new pet, a new animal, a cat, a dog, something that might be triggering this red eye.
Any exposure to chemicals. Obviously, if you get something splashed into the eye, you will start tearing, and that can then irritate the eye, lead to inflammation, lead to redness.
This can also be aerosols too.
Oh, absolutely.
Something in the air that's just very irritating, even dust in the air. Here in Arizona, we get a lot of those dust storms that can cause that.
And then other systemic symptoms now would lead you more to believe that this is a problem that doesn't only affect the eye. The eye is one manifestation, but the rest of the body can be affected by this as well.
And any other systemic diseases, other autoimmune issues, this is all related. We're looking for some trigger for the red eye. The timing to me also is kind of important because an acute red eye means it came on very suddenly. We usually can figure out what caused that. Something got in the eye, the cornea got abraded. It's a viral conjunctivitis that came on very suddenly. Maybe a corneal ulcer from contact lens wear, even something like angle closure glaucoma or uveitis, this very sudden incidence of a red eye that's very uncomfortable for the patient.
And that's the key word. It's like they have a lot of pain with it. It started all of a sudden. I got pain, the eye got red. Well, you know it's related. Chronic red eye is a little bit more difficult. It means that it's been around for more than several weeks, which now it becomes more challenging because a lot of things can do this. And sometimes even our treatments for red eyes or for eye problems can be a causing factor, as in eye drops.
Those are the ones that didn't start overnight. They're not going to go away overnight. We need to have a little bit longer prolonged treatment course to take care of those. Back to the vision loss thoughts. Conjunctivitis strictly, just if it's affecting the conjunctiva, normally will not decrease the acuity. If there is vision loss, we think about some corneal problem like a keratitis or an intraocular process, something inside of the eye affecting the vision.
Correct, and that can be anything. That can be something affecting the retina, the optic nerve, the vitreous, the anterior chamber, uveitis, the iris, the lens, the cornea, and literally from everything further back. So it's red eye plus another problem as opposed to just something that affects the conjunctiva.
And in future videos, we're going to go into more of the specific causes of conjunctivitis, but hopefully that gives a framework for how we think about a red eye when it presents in the chair.